These are the risk factors for impotence with the treatment of prostate cancer. The risk factors for impotence associated with the treatment of prostate cancer really first start off with the patient themselves. Usually, what I tell my patients is if they start off as not having the erectile dysfunction, and then I start talking about their age. Usually for people who are between anywhere from 40 to 60 years old, they tend to have very little risk associated with any type of erectile dysfunction after prostate cancer treatment. That could involve anywhere from surgery, potentially to radiation, and to some degree cryotherapy. With surgery, if they undergo a surgical removal of the prostate where the nerves that help control erections are preserved, or i.e. call a nerve-sparing operation, then the patients in most cases should recover most, if not all, of their function within a year or so of their operation. They may sometimes have to still take some medications that are like Viagra, Levitra, or Cialis to assist with getting an erection, but in most cases those patients tend to return to have their own spontaneous erection after this. This, of course, also is similar in terms of some of the outcomes associated with radiation therapy, because the nerves themselves are not necessarily disturbed by any type of removal, but they still potentially can pose a risk because they are radiated. And therefore, those are some of the risk factors. On the other hand, if a person comes in, they have underlying diabetes, they have a problem with their heart where they have coronary artery disease, they're on hypertension medication, that person is certainly a much greater risk of being impotent after any form of therapy, whether it would be potential removal of their prostate or if they have radiation. Part of this risk factor also depends on the extensiveness of the cancer itself. And going back to what I said earlier in this taping, if someone, even in a young individual, presents with very advanced cancer where it involves both sides of the prostate, then it would make it much more difficult for a clinician to offer a nerve-sparing operation, because that would potentially leave behind cancer itself to sacrifice erection, which is obviously not a wise choice.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.